They are saying is that King's lawyers are claiming that King suffered a brain injury as a child, as Josh just referred to. But will that be enough to keep him from being executed? The defense has another trick up its sleeve, and we are going to be hearing about that. ABC7's Callie Zenandri is also at the Judicial Center. She's going to be joining us now with more. She is at the Judicial Center and is here now to tell us what else the defense will be doing. Callie?
Well, Heidi, it was an emotional day inside the courtroom, but today there was also some more medical testimony. A medical examiner from California took the stand today, saying that an injury that King received when he was just 6 years old could be to blame for some of his actions. Today we heard from Dr. Wu. He said that he's from California. He spent the good portion of the morning breaking down how a PET scan works, then saying King has abnormalities in his brain that were possibly caused by an accident while he was being pulled by a snowmobile when he was 6 years old. Wu says that the injury could cause psychotic tendencies and could be unable, and that King could be unable to express normal emotion and logical behavior. A local doctor here in Sarasota says modern technology now allows us to see how the brain functions.
The people who have frontal lobe injuries from head injuries, whether they're actually fracturing their skull or not, can have behavioral changes that can be long-lasting.
Now, in the next few days, a brain expert will also be brought up by the state that is supposed to refute some of the things that Dr. Wu said today. We will continue to follow this as it unfolds. Heidi, back to you.
All right, Callie, thank you very much. In other news, Sarasota police are hunting. Welcome back. We are taking your calls about Parkinson's disease today. Dr. Dean Sutherland is a Suncoast neurologist, and he's here to give you free medical advice right now. All you have to do to get free advice about Parkinson's disease is call 552-3130. 552-3130. Right now, we're taking your calls live on the air. Good to see you again.
Hi, Heidi.
Tell us about Parkinson's disease and how it affects us here on the Suncoast.
It's a disease that affects 1 to 2% of the entire population at some point in their life. So that means there are at least 5,000 patients in our local area that have Parkinson's disease. That's a lot of patients, and that includes a lot of caregivers that are associated with that, their spouse or their children. We think that it affects approximately 15,000 total.
Here on the Suncoast?
Yeah.
All right. Well, we have a caller on the line now. It is Kathy from Bradenton. Hi, Kathy. What is your question about Parkinson for Dr. Sutherland?
Hi, Heidi. Yeah, listen, my mother has Parkinsonian. Could you tell me if that's related to Parkinson's, and how likely would I be to get that disease? And I'll hang up and listen to your answer.
Good question. What is that?
That's a great question. Parkinsonism, or as you refer to it as Parkinsonianism, is when you have symptoms that look like Parkinson's, but you can't really be diagnosed with Parkinson's disease. So Parkinson's disease is caused by loss of dopamine, which is a neurotransmitter, in a very particular part of the brain. Parkinsonism can be caused by a lot of things: little small strokes, increased pressure inside the brain. Certain medications like Reglan can actually cause it. Depression can cause Parkinsonism as well. So Parkinsonism is more a description of slow movement, shuffling gait, sometimes some problems with your emotions. Whereas Parkinson's disease is very specific to this one process, of which most people have a resting tremor, as well as the problems with their walking and their balance and their facial expression. And
is that caller likely to get it if her mother has it?
No, she's not likely to get it. The likelihood that you'll get Parkinsonism is very low if your parent has it. Now, if it's truly Parkinson's disease, the risk is slightly higher, but still it's very small.
Okay. We have another caller on the line, Dan in Sarasota. Hi, Dan. What is your question about Parkinson for Dr. Sutherland?
I'm in my mid-60s, and a year or so ago I developed just a slight tremor in my left hand, and it just hasn't gotten any better, any worse, and I wondered, is that a early sign of Parkinson's, or is that just a sign of getting older?
You know, tremor can suggest that you have Parkinson's disease, but it doesn't always mean that. If you have a tremor that's at rest when you're not doing anything, then that may suggest Parkinson's disease. A lot of patients, though, and most people, even with age, can develop a tremor that's more related to doing things. It's called an essential tremor. When they're trying to do something, it gets worse. When they're at rest, it gets better.
I have one already. All right. Let's go back to the phones now. Caller, are you there? What is your question for Dr. Sutherland? Hello, are you there? I think we lost that person. All you have to do is give us a call right now, 552-3130, if you'd like to ask Dr. Sutherland about Parkinson's disease. Now, there is a group in town that aims to help people with Parkinson's disease because it's very confusing to manage. It's called NeuroChallenge. Dr. Sutherland heads it as the medical director. I'm on the board. And it aims to provide a really important service. Tell us about it.
Well, you know, we have a lot of patients in the general area. We have a lot of resources that are available. Over the last 7 years or so that I've been practicing in this town as a neurologist specializing in Parkinson's disease, it's become obvious that there are resources that are available, but they're not really gathered up into one place, you know, where you can easily access them. That's really what NeuroChallenge does for us. One really important aspect of what we're trying to work on right now is we have a patient and family advocacy program that we're trying to work on. We're trying to have volunteers who have knowledge about Parkinson's or nursing, social work, things like that, that can talk to their peers basically and talk to other people that might have the disease to help us out. We know that there are a lot of very intelligent people with a lot of training in this town who can help us out with that. So we're actually asking for people to call in and to give us their expertise if possible.
Okay, so if you're interested in helping out at NeuroChallenge, you can go ahead and call the hospital 917-1000. Also coming up to benefit NeuroChallenge, there is a golf tournament in October. Tell us about that, Dr. Sutherland.
The golf tournament is going to be great. It's going to be out at Heritage Oaks. Right now it's being organized mainly by Mark Bisgeyer, who was here a couple weeks ago. It's going to be fun. We're going to have a regular golf tournament. There's going to be prizes. There's going to be a dinner at the end. Overall, we expect as many people who are Parkinson's patients and are golfers at the same time to join us, but we also want other people. We want you know, doctors, nurses, anybody who's interested or has a family member in Parkinson's disease. With Parkinson's disease should come and join us. It's going to be fun.
And that, of course, will help the people who do have Parkinson. We have another caller on the line. Sharon is on the phone. Hi, Sharon. What's your question about Parkinson for Dr. Sutherland?
What are the first stages that you would notice in Parkinson's?
What would they be?
So many patients, the first thing they'll notice is a tremor, as the gentleman had called in earlier. So that might be one of the first things that you would tend to see. But other people can have shuffling or stumbling. They may have a lack of expression, and people may think that they are angry or upset when in fact they're not. Your balance may get bad. Those are kind of the four main things that we tend to see first. Now, sometimes people present in a weird manner. They may have sudden anxiety attacks, or they may have problems with sweating episodes or low blood pressure. But in general, most times it's usually tremor and gait and balance problems with walking, falling.
All right. Well, thank you so very much for coming on and helping our viewers. We certainly appreciate it. And if you'd like to help the people who have Parkinson here on the Suncoast, remember, you can go to that golf tournament. You can also go to mysuncoast.com and click on Health Smart for more information about that. We'll be right back. Caregiving for Parkinson patients can be a full-time job. It is hard physically and emotionally, but we have help. A free event coming up this weekend in Sarasota. And joining us now with more is Doreen Sutherland, president of NeuroChallenge Foundation. So nice to see you again. Thanks for coming back.
Thanks.
What is this free event?
It's called the Caregiver Cruise. It'll be on Saturday, and what it is just fun for caregivers. They need time out. They need to have all kinds of fun things. There'll be all kinds of prizes given out, from manicures to exercise plans to information. We're good at giving information, so there'll be that. It's just a day out.
It's a day out, so yes. It's a little bit of respite.
Exactly.
But it's also about information. Tell us about that.
Right. Well, what we do at NeuroChallenge is we're trying to get all resources that we have in Sarasota County out to people. So that's part of what we're going to be doing on that day, is giving people information about what they can do to make their lives easier while they're helping their loved one.
And why is it so hard to care for someone with Parkinson?
Well, one of the reasons, and I can speak from personal experience on this, my dad lived with us for 12 years, from the time my mom passed away until he was 90 years old. I had 4 children during that time, and my picture is putting my dad in a wheelchair, putting 2 children on top, putting 2 people out front to clear the way, and getting through an airport. Was I depressed? Yeah, part of the time I really was, so I understand what people are going through with that. We need to get people the information we can as easily as we can, because they're not really able to get out, process that information themselves, and find what they need.
Mm-hmm. So it's very depressing. It can be very depressing.
Not for everybody, but there's a study out there, 46% of caregivers overall in our country experience some kind of depression.
And it's also hard watching your parents deteriorate.
Yeah.
It really is. And Parkinson is such a devastating disease. It can go slowly or it can go quickly, and in my family I've seen it do both. But it is very hard. And also it's a financial toll. Tell us about that.
Yes. Caregivers, on average, $13,000 a year that they're losing of their own income. And of course, there's lots of expenses that go into caring for somebody and making sure that they have the best care that they can get and get that extra time where they feel well during the time that they have Parkinson's disease. I think that there is probably about $5 million in our community of resources that are going unused by the 15,000 people that we care for. We know that. We're trying to bring them in, get them to the places they need to go. Who wants to throw $5 million in the trash in our community? We don't want to do that.
So this Saturday they can come and they can go to this event. They'll get a little bit of levity in their lives. But also tell us, can you bring your Parkinson's patient with you? Your
definitely.
loved one?
Bring your the person that you're caring for. They'll enjoy it too. We got little drinks with umbrellas in them and candy and food and just lots of things. So they'll be busy. The caregivers can be busy and travel with them as they go and check out all the stuff that'll be there.
So you can bring everyone
Definitely.
along. Well, let's tell everyone how you can be involved. If you'd like more information about the Caregivers Cruise, which is a fun theme name for a sort of a serious and yet lighthearted event. It is this Saturday, September 26th, from 10 a.m. until 12 p.m. It is at Sarasota Memorial Hospital's Institute for Advanced Medicine. That's on Clark Road near I-75. The number is 926-6413. Again, it's a free event, 926-6413. Doreen, thank you so very much for coming. We appreciate it. And now let's go to Chief Meteorologist Bob Harrigan. Bob?